Your charts were stunningly laying plain the benefits and who benefits from the Republican bill that we saw in the House. The CBO, as you pointed out, plainly demonstrate that 23 million Americans will lose health care. But I've heard you talk about this with other issues, about how we as Americans are far more connected than we realize. That while one family might suffer from lack of health insurance, like the folks you talked about at the beginning of your remarks, the reality is when that child doesn't get the health care that they deserve, when they don't achieve in life to the great potential that they might have, others suffer as well. And we see this, you're on the Foreign Relations Committee, as you travel to European countries that have vastly more people insured, vastly more investments in childhood education and childhood health care. I'm just wondering if you could extrapolate for me for a moment that this isn't just about individual families who are vulnerable. This is really all Americans who suffer when you have other Americans not getting the benefit of health care in this country.
You know, I think we all got a gut punch earlier today. We received news that this young man who just came back from North Korea after having been abused and tortured there passed. And if you read the statement from his family, it was hard to read, right? And you couldn't help but read that without sort of just feeling your heart drop into your stomach. Why? Because this is a young man with such promise ahead of him, who had that future robbed from him. And I didn't know him, and you didn't know him, and the people in my state who were similarly affected didn't know him, and yet they felt something. And I think the reason that this bill is so wildly unpopular is because people are going to die. I mean, the fact of the matter is, if people don't get coverage for addiction, if folks don't get to see a doctor who are mentally ill, they aren't going to survive. And people, you know, even those that have enough money to be able to pay for the premium increases in this bill, they know that there's something a little evil in wanting to do this to people. And as you remark, even if you're not amongst the 23 million people who lose insurance, the CBO also says that your rates are going up, right? Because when those people don't get health care insurance, they show up somewhere else in the system. They show up at the emergency rooms. They get much more expensive care. That cost gets passed on to the rest of us. And so even if you're lucky enough to not be amongst the 23 million, you are going to be personally financially affected by this. The CBO says that everybody's rates go up by 15 to 20%. But even if it's not the money that you care about, we are all connected, and nobody should want this to happen to people. We're all weaker if we pass a piece of legislation here that ends up hurting people in such a real, meaningful, and devastating way.
And if I can, Senator Connecticut, just ask one more question. That interrelatedness, it's a part of a larger system, and these systems we all benefit from. And you mentioned momentarily ago hospitals, and how whether it's my family that gets injured and is rushed to a hospital, or a wealthy family or a poor family, those hospitals are a critical part of a healthcare system. Now, I was a mayor of a city, and I imagine my experience is similar to yours in Connecticut. Our hospitals, before the Affordable Care Act, were having a really difficult time because so many of those costs at the most expensive point, when a disease had become so much more acute, were being pushed into hospital emergency rooms, and my state was having a very difficult time with the costs of that so-called charity care. They had literally tough choices. They weren't going to just close their door when someone goes into diabetic shock, or someone has an asthma attack, or some of these diseases that are not treated in an earlier stage. And I'm wondering if you could help maybe explain, in terms of Connecticut's perspective, why this has an impact on all of us in terms of the systemic healthcare systems that sustain our communities and our societies.
Well, I think it's really important to understand what the law says, right? The law says that there's only one healthcare provider that by law has to treat every single person who comes in the door, that can't turn away individuals based upon their ability to pay, and that's the emergency room. But what we also know is that the emergency room is the place where you get the most expensive care, right? By the time you get there, you are often in crisis, and the care that you receive in the emergency room is expensive, and then all of the care that you need afterwards is expensive as well. I always remember a woman from Connecticut who lost her Medicaid coverage, and in losing her Medicaid coverage, she didn't end up being able to see a doctor for an infection she had in her foot. And it was hurting her for a long time, that infection. And she didn't have Medicaid any longer, so she just decided to let it hurt. She popped some Tylenol and hoped it would go away. And one day it was just so painful that she went to the emergency room, and it was too late. It was too late. Her foot had become so badly infected that she had to have that leg below her knee amputated. And she had no insurance, so we all picked up the cost of that, but she had her life altered in a way that is hard for us to fathom. And there's not a single winner in that scenario, because obviously her entire life is changed because of that. But it's not like we saved any money in treating her so shabbily, because we ended up having to cover all of those costs. And that's just one story. But if you think about what the House bill does, it repeats that story millions of times over. So it's morally bankrupt, but it's also fiscally imprudent and foolish.
Well, that brings up one more thing, Senator Murphy, and if you'll indulge me, because I just visited your state, and as I was talking to a lot of your members, being from New Jersey, there might be a small little rivalry between our two northeastern states, and some of your folks came up to me and got in my face in a polite and joking way about how our Constitution was formed, and they talked about the Connecticut Compromise. And as you well know, this was a compromise that allowed our republic to form. And an understanding that we'd have two bodies, the House and the Senate, and every state would have two members representing it. And in many ways, the founders of our country coming out of this viewed this body very differently than the other body. Now, the other body you served in, and I'm hoping maybe you can shine some light. I've been here 3.5 years. You've had experience as a House member and experience as a senator. You said something that some people at home might dismiss as hyperbolic partisanship, but I actually think you are absolutely right. I've been here for 3.5 years, and I've seen this body change. And what frustrates me is when I was here a brief period of time when Democrats were in the majority, and I heard my colleagues on the Republican side talking about regular order, how urgent regular order is, how when we're in charge, we're going to have regular order. The leader spoke publicly about this thing called regular order. Now, the House operates on majority rule. And there's a different, our founders saw that as a very different body than this, which is in many ways talked about a different rhythm, a different way of doing things. In fact, how one senator over here can have a lot of power within this system, sometimes to the frustration of folks to slow things down. Now, you made this claim about this being broken, and I think this is a perfect example of it. This idea that this would be the body that on such a big issue would have a chance to be deliberative and to focus on this. Could you just, because I really think that you're right. We have seen this body in a very short period of time that I've been here begin to undermine not just things that happened under the Obama administration, but undermine traditions that go back decades, if not more than a century. And I just wonder, being the state, as I was told, so critical to our Constitution, I was wondering if you could just give some light on why you really are substantively, factually saying that this is probably one of the nadirs, the low moments of the United States Senate in the way that this process is being done.
There is right outside the Senate chamber, a picture of the authors of the Connecticut Compromise, two of the Connecticut delegates to the Constitution Convention. I appreciate this.
I need to check my history. They might have been born in New Jersey.
Shout out to Connecticut. But no, you are right? The idea of the House is that it is supposed to respond perhaps more quickly to the temporary passions of the public, which is ironic given that the passion of the public today is in deep opposition to this piece of legislation. Unfortunately, the House is responding to the passions of one very small portion of the public, which is the sort of extreme Republican base, which maybe is the only remaining segment of this country which supports the American Health Care Act. This place is supposed to be able to step back and look at the long term, right? Look at the long view. That's why we have 6-year terms, so that we don't do something that may feel good in the moment politically, but has devastating impacts over the course of time. And that's exactly what this debate is about. It's about a massive reordering of 1/5 of our economy that has just enormous consequences over time when these people who lose insurance start to feel the effects of that as they bleed through their savings over 5 or 10 years and go bankrupt at the back end of that time period. And so this is a place where both parties should be able to sit down and talk about what this really means for folks. And I thought Senator Schatz put it well. When you don't engage in regular order, I mean, not only do you do things that are very partisan and political, but you also do things that don't make sense. One of the things that regular order brings is the ability to talk to experts, right? We all sit on committees, and those committees bring experts to the table to tell us what the impact of legislation is. There's been no committee process on this bill. We haven't had a single committee meeting. We had one hearing in the Health Committee upon which I sit. And so, as Senator Schatz said, the result is a product that is garbage, that just logistically does not work because neither the House nor the Senate engaged in the kind of deliberation that would get you to the facts. So yes, this place is supposed to work differently, but also you're supposed to use the committee process to make sure that you're not passing something that just makes sense politically, that makes sense from a policy standpoint as well.
Thank you, Senator Murphy, for giving me those few moments. I was wondering if the chair would be willing to recognize me to give some remarks for a few moments myself.
The senator is recognized.
Thank you very much, Mr. President. So I just want to pick up from that conversation we were having, which is Senator Murphy really laid it plain on his charts about larger issues with this bill. But I want to get back to the point he was just talking about that I've observed here in the United States Senate for about 3.5 years is the functioning of this body. I love history. It's something that I'm one of these guys that doesn't read any really nonfiction anymore. I love reading about this country, about its past leaders, about great moments in history. And what's interesting about this body being someone who has the privilege to stand on this floor, quite literally given to me by the state that I love, New Jersey. And I walk on this floor and I feel a sense of history every time I'm here. 3.5 years, and it hasn't lost its wow factor for me I get to stand on this floor. And I have to say, I love my state, and in my campaigning, I don't think the issue that I'm New Jersey's first black senator really came up that much. New Jerseyans just want to know, would I come down here and fight for them? But I was aware of the history about being the 4th African American elected in the history, popularly elected in the history of this body. And I came down here as a student of many of the great moments in time on this floor, and many of the records that were set. And I think some of those records are really germane to this moment right now. The longest filibuster on this floor, where one senator could actually grind the workings of the Senate down to a crawl because of Senate rules and Senate traditions. In this case, something I wasn't even alive for it, but something that to me is frustrating, but it's a moment of history that shows what regular order is. It slows down this body that a filibuster takes 60 votes to overcome. And so here was this moment, it was actually almost exactly 60 years ago that was the 1957 Civil Rights Act, and it was Strom Thurmond that gave this long filibuster trying to block something that, yes, indeed, was going to have societal impact on this country, the 1957 Civil Rights Act. Now, this is one illustration of how when monumental pieces of legislation are coming to this floor, the history of this body, the traditions of this body, to slow things down, to have a process, to have rules, especially for things that are so monumental. In this case of the 1957 Civil Rights Act, something we look back in the past and say, wow, it took them a long time to get there. But it demonstrates what this body's rules have been about for a long time. Let me go with another record that I mentioned earlier tonight, but it shows again that when monumental pieces of legislation are coming, this is a body that looks closely, takes its time, is deliberative, and has a time-honored process. And that is the other record set by the longest consecutive session in Senate history, was a debate about truly one of the more important things in our society, which is issues of war and peace. The longest consecutive session in Senate history of debate, of deliberation, open and public, for not just the nation to see, but for the world to see, was a debate during the First World War about whether to arm merchant ships. It brought about tremendous consternation, tremendous debate as we were doing the lead up into the First World War. Now, what's interesting is if you think about the forming of our country, in that debate, again, Constitutional Convention, public, open, transparent, issues were debated. And one of the fundamental reasons for organizing our government was seen as the protection of the American people. The ideals of a common defense, the public welfare. These were the things literally put into the preamble of our Constitution about what this government is about. That these are the most important ideals. In fact, we herald some of these ideals. They have become part of our civic gospel. Everyone knows when they hear the words liberty and justice for all, part of our civic gospel. Well, part of that gospel as well, in the core center of our country, is that this is a nation about life, liberty, and the pursuit of happiness. That word life, this government, this republic, affirming the ideals of life, it is only understandable that when we are debating epic pieces of legislation that will go to affect the lives of tens of millions of Americans. I was in a children's hospital today. Families in peril, families in crisis, talking about the lives of their children. I've seen it happen, unfortunately, to neighbors and people in my community when the lives of their children are at stake or threatened or afflicted with disease. It puts so many things in perspective. And so here we have legislation speeding its way to the Senate floor that go to the fundamental ideals of this nation. Will we be a country that has a system of health care that affirms life? Now, it is no coincidence that when we're talking about records in the Senate, it is no coincidence to me that the longest time that there was a consecutive session in Senate history for debate, no coincidence to me that one was about war and peace, the rush, as some people saw it then, towards war in World War I. But what's fascinating is that folks should know that the second longest consecutive session in Senate history was about health care. And it was in 2010. It was over the Affordable Care Act. A bill that the full Senate spent 25 consecutive days considering, 160 hours, not including, though, those 160 hours in session, does not include hundreds more hours in committee hearings, in meetings, all that took place in the development of a bill that came to this floor and set a record about being the second longest debate. It is perfectly justifiable that that bill should have taken so much time, so much focus, that the world's greatest deliberative body would deliberate, would do its job. And for that piece of legislation, don't believe the lie. It wasn't rushed through here. It didn't get the express train through the United States Senate. It set records for discussion, deliberation, debate, and a process that included comments and input and thoughts and testimony from Americans across the country. Not just red states, not just blue states, but all of Americans. And it was justifiable. It was absolutely justifiable. I wasn't here. I was at home in Newark. I was mayor of the city. And this debate went on and on and on and captured the attention of the nation. Something I've never seen before and I haven't seen since. The President of the United States, then Barack Obama, this to me was stunning. It caught my attention. On national TV cameras, sure it was C-SPAN, not what I turn to first when I'm home relaxing on my couch. But the President of the United States invited Congress in, Republicans, some of the smartest minds. I've served here 3.5 years now. Some of the smartest minds I've met in this country are here in the Senate on the Republican side. He invited the Congress in to discuss and debate with him on live TV health care. I don't know if Reagan did that. I don't know if Bill Clinton did that. I can't remember that they did. So here was something that was done fully in the light, vetted, debated, deliberated, discussed in open air. And the hearing numbers are incredible. I've been here 3.5 years, and I've never seen anything like it. In the Senate's so-called Health Committee, health, education, labor, pensions, they held 14 bipartisan roundtables, 13 bipartisan hearings, 20 bipartisan walkthroughs, and they considered 300 amendments. And this is the thing that I didn't know till I got to the Senate because of all the rhetoric on 24-hour cable news. This wasn't a pure Democratic bill. They actually accepted over 160 amendments from Republicans. The stories I've heard from people on both sides of the aisle is that they were bending over backwards trying to pick up one Republican vote. And so they incurred and took on amendments that actually shaped the bill, Republican ideas onto this health care bill, 160 amendments. But stop, that's only in the Health Committee. In the Senate Finance Committee, they held 17 bipartisan roundtables. They held summits and hearings, 13 member meetings and walkthroughs, 38 meetings and negotiations, bipartisans. They held a markup. I've been to lots of markups. I've never seen them last, or scarcely can think of times they've lasted more than a day, but they held in the Finance Committee a 7-day markup on the bill. That 7-day markup, talk about records, that 7-day markup was the longest markup on a bill in 20 years. That was the process. A bill affecting that fundamental American ideal that this nation, founded like no other, not a theocracy, not a monarchy, the oldest constitutional democracy on the planet Earth that affirmed ideals, that put into the ether of Earth for the first time this Constitution talking about life, liberty, and the pursuit of happiness, that this health care bill involved such debate and discussion. And the nation participated. Policy experts, market experts, medical professionals, health nonprofits, insurers, hospitals, Americans all got to put forward their input, their ideas. Sure, all of them were not accepted, but into the mix went everything. And so this should be shocking to the consciousness of all people, of good conscience, that aren't reflexively partisan, but look at the history of this country. History that is proud, history that should be shameful, about how things got done in matters of war and peace, in matters of foreign policy and domestic, in matters that made it possible for me to stand on the Senate floor like integration and civil rights. There was a process. And somehow in the last 3.5 years, in the name of what? A vicious brand of partisanship that somehow undercuts not just the voice of Democrats, not just the voice of policy experts, not just the voice of hospital experts, not just the voice of medical professionals, doesn't just undercut their involvement in the process, but it is an insult to the history and the traditions of this body. This was not the constitutional intent, that something as important as health care should be done in a back room where a small handful of senators are trying to hammer out amongst themselves a piece of legislation that's going to affect tens of millions of Americans and change our economy and change our communities. There is honor in this place that isn't on TV. There are good folks on both sides of the aisle. I've gotten to know them. I consider folks my friends. I know their hearts. This does not sit well, the way this is being handled. I know it. And this is one of those moments of history that somebody just needs to raise their hand and say, you know what? I may even like that bill that came out of that back room. I may like that bill that was hammered out by 12 Republicans. But this process is wrong. It is an insult to our history. I wouldn't want this done to me. This is the moment. It's a test. History will look back and see what this body did at this moment in history. I fear we're going to fail the test. But what's even more painful than that, for me, is not just the sadness or the anguish I feel about a body contorting its traditions, breaking its way. What even hurts me more than that is what they're going to be pushing through. We saw it in the House. Instead of this body coming together, and literally there is agreement on this, all of us believe the Affordable Care Act needs to be improved. I've had it in conversations, formal and informal, that we could build upon the Affordable Care Act. We could correct for its deficiencies, and we could build upon its extraordinary successes. I see those extraordinary successes in my state. I have Republicans and Democrats who are now fearful about the consequences should a bill like the House Republican health care bill be made law. Folks who fear for their families, fear for their children, who don't want to go back to a nation that we had before it, where the number one reason for bankruptcy was not being able to afford your medical bills, where people with pre-existing conditions were denied insurance, when mental health care wasn't on parity with physical health care. I could go through all the things that I've seen make a huge difference in New Jersey, in communities rural and urban, for Americans. And I want to highlight some of those right now, some of those questions that people are asking at home about what happens if a bill like the House bill becomes law. If they take that bill here in the Senate and push it through, have it back to the House, and these bills that subverted process and inclusion and debate and deliberation go to that process called reconciliation. There's questions that are being asked. Here's one. What happens to a mother who's pregnant with, say, her second child, who suddenly loses Medicaid coverage? Now understand, a very large percentage of the children born in the United States of America are born covered by Medicaid, which we already see in this House bill is being gutted, the biggest rollback in the safety net in our country in my lifetime and more. What happens to that mother who's pregnant with her second child, loses her Medicaid coverage and her parental care, prenatal care? She loses her prenatal care along with it. What happens to that American citizen? What happens to that baby? Well, we know that according to the United States Department of Health and Human Services, babies born to mothers who receive no prenatal care are 5 times more likely to die than those whose mothers did receive prenatal care. 5 times. And tragically, women without prenatal care are 3 to 4 times more likely to suffer maternal mortality. That means dying in childbirth, than women with prenatal care. And these rates significantly increase for women of color. What happens to the tens of thousands of mothers who may lose access to maternity services? And what happens to the already dismal infant mortality rate and maternal mortality rates in our country if this plan goes through? That is a legitimate question. The data is clear. You restrict access to prenatal care, you endanger children, Americans, you endanger mothers. But let's keep asking those questions. What happens to the healthcare worker who works 60 hours a week taking care of others, but loses their own health care coverage, and then is unable to afford getting screened themselves, preventative screenings for cancer, let's say ovarian cancer? What happens to them? We don't have to imagine what happens when millions of Americans forego preventative screenings. We have factual data on what happens should access to those preventative screenings, like what happened with the House health care bill, what happened? The American Cancer Society tells us clearly that inadequate health coverage is a barrier to preventative care, early detection, and optimal treatment. They find, for example, that patients with stage 2 colorectal cancer that have it detected had higher survival rates. In fact, they point out that people with stage 2 colorectal cancer with adequate health insurance have better survival rates than people with stage 1 colorectal cancer that have no health coverage. In other words, the American Cancer Society shows that access leads to survival and denial leads to higher rates of death. A recent cancer study found, and I quote right now, the number of Americans whose cancers were diagnosed at the earliest stage when it's most likely to be cured increased after Obamacare went into effect, and more citizens had access to health coverage. You take away the expanded coverage that was found through Obamacare, you decrease preventative screenings, you decrease early detection, and as indicated by the American Cancer Society, death rates go up. Another question in general, what happens to cancer rates in America when these gains are reversed? What happens when these gains are reversed? What happens to the father of two who's diagnosed with a rare cancer, who can't afford the additional estimated $82,000 his cancer treatment goes up if this bill, like the Republican House bill, passes? That's what's estimated, $82,000 would his cancer treatments go up. What happens when he can't afford that care? When he's forced to choose between his family's home, for example, and treating his cancer? Well, this is what we know. These are the facts. That from 2010 to 2016, personal bankruptcy filings have dropped close to 50% in the United States of America. One of the collateral benefits of Obamacare, 50% drop in personal bankruptcy filings, with experts agreeing that the Affordable Care Act played an important role in this significant decrease. A group of economists, has estimated that the House Republican bill would cost the average enrollee more than $1,500 more per year than the current system. This is despite the fact that surveys have found that the majority of Americans have less than $1,000 in savings. With one study finding that 63% of Americans don't have the savings to cover a $500 emergency. Remember what Senator Murphy showed. That's a bill that gives massive tax cuts to the wealthiest of Americans, shifting the cost burden so that the average enrollee now under this bill is going to see a $1,500 more per year payments when the average American hasn't have the saving to cover about a $500 emergency. Let me ask another question that folks are asking. What happens to the family whose child with a disability loses their access to home and support services, to physical and speech therapy that they receive through Medicaid if the Republican plan goes forward? I was in a hospital today with such parents telling me about children who the only way they got the coverage was because of the expanded Medicaid. And now what happens under the Republican plan? Well, we know that Medicaid is a critical lifeline for people and families with disabilities, providing access to things like rehabilitative therapies that help children meet developmental goals. One of the incredible women, young girls I met today, because of developmental therapies, she went from not being able to walk to now continue to do the things that her normal teenage peers and her twin sisters are able to do. We know that today, 15% of kids are growing up with a developmental disability, and in New Jersey, 1 in 41 children live with autism. But this plan we saw pass in the House threatens to make it more difficult for children with disabilities to receive the care they need, to go to school, and to live healthy lives. Losing coverage could mean the difference between a child with a disability achieving a developmental milestone or falling further behind. And unfortunately, in the Republican bill that passed the House, that's exactly what will happen if it should become law. If that bill passes, what happens to older Americans who don't yet qualify for Medicare but still need access to critical health services? Well, we know that because insurance companies would likely be allowed to change older Americans to much higher premiums under the Republican plan. Remember, it used to be capped. The costs for older Americans used to be capped. It's now being estimated that Americans between the ages of 55 to 64 would pay some of the highest increases. It's estimated that increase would be $5,200 more per year. Standard & Poor's actually estimated that premiums for a 64-year-old could increase by 30% under the Republican bill that passed through the House. The Congressional Budget Office noted in their report on the House Republican health care plan that, and I quote, although the agencies expect that the legislation would increase the number of uninsured broadly, the increase would be disproportionately large among older people with lower income, particularly people between 50 and 64 years of age, with incomes of less than 200% of the federal poverty level. Think about that for a second. Executives of insurance companies, pharma companies, the richest would get tax breaks into the hundreds of thousands of dollars, but the poorest folks, elderly in our community, according to the CBO, would see their costs go up considerably. The New Jersey Hospital Association noted that, and I quote for them, under current law, a 64-year-old making $26,500 a year will pay an average of $1,700 in annual premiums. Under the AHCA, the Republican plan in the House, that same individual making just above minimum wage, they will pay, under their plan, between $13,600 and $16,100 in premiums. That's the increase for older Americans, working Americans. That's the increase. We know that if more older Americans lose their health coverage and in turn enter Medicare in worse health, our entire Medicare system is made weaker and less solvent. And if this bill passes, what happens to older Americans who have already spent their life savings in nursing homes? Well, we know right now, for elder Americans that are in nursing homes, that Medicaid actually covers the cost of 2 out of 3 of those individuals. In a piece that just ran this past weekend in the New York Times, and I quote, roughly 1 in 3 people now turning 65 will require nursing home care at some point during his or her life. 1 in 3. Over 3/4 of long-stay nursing home residents will eventually be covered by Medicaid. Many American voters think Medicaid is only for low-income adults and their children, for people who aren't, quote-unquote, like them. But Medicaid is not somebody else's insurance. It is an insurance for all of our mothers and fathers, and eventually for ourselves. I continue the quote, Mr. Trump and the Republicans would lower spending on the frailest and most vulnerable people in our health care system. They would like most Americans to believe that these cuts will not affect them, only their quote-unquote undeserving neighbors. But that hides the truth that draconian cuts to Medicaid affect all of our families. They are a direct attack on our elderly, our disabled, and our dignity. I want to wrap up with just this concluding thought. We know right now that we are at a turning point in our country. That the process that has made this deliberative body known throughout the land, throughout humanity, that this deliberative body is about to alter its traditions and have a bill that affects tens of millions of Americans, done and crafted in a back room without public input, will be rushed to this floor. That's what the process is right now. It was Martin Luther King in a speech to the Medical Committee for Human Rights in 1966 that said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. This bill will perpetuate injustice in our nation. It will further the gulf between the haves and the have-nots, but it will not just target those most vulnerable, the elderly, the poor. It targets all of us. It targets our character as a country, our highest ideals. the very core of many of our faiths. To the least of these, we cannot allow this legislation that will so hurt our country to be crafted in darkness, behind closed doors, that subverts a tradition, a mighty tradition of the world's most deliberative body, to be rushed through when it will cause so much damage to so many Americans, and indeed the very soul of our country. Mr. President, I yield the floor.